will pass it over to Claire to introduce our presenter.
Thank you, Kara. We are so delighted that Mr. Ramadhan Kirunda is here with us today. Mr. Kirunda is a multidisciplinary design, monitoring, evaluation, learning, QI, and social norms expert with over 15 years of implementation research experience. He has experience in intervention design and implementation support, specifically in the areas of HIV and AIDS, immunization, gender-based violence and violence against children, sexual and reproductive health and rights and family planning, and social accountability for health. As a learning and improvement scientist and enthusiast, he is a member and fellow of the International Society for Quality in Healthcare, a member of the World Health Organization's Global Learning Laboratory for Quality Universal Health Coverage, the European Implementation Collaborative, Global Social Norms and Agency Learning Collaborative, and a member of the Core Group for Social and Behavioral Change Working Group. At the national level, Mr. Kirunda is a member of the DMPA Scale Up National Task Force, Family Planning Technical Working Group, National Task Force on Family Planning in Private Drug Shops. Currently, he is a technical advisor on adaptations, scale up, and QI at Impact and Innovation Development Center, and he provides technical assistance to implementing organizations working to promote gender, child rights, women's rights, healthcare, male caregiving, and sexual and reproductive health and rights in East and Southern Africa. His main program support areas include intervention design, monitoring and evaluation, formative exploratory research, adaptation, QI, and capacity building in social and gender norms. We have so much to learn from you, Mr. Kirunda. Welcome. I'm super excited to hear from you and learn from you today. So I'll pass the mic over to you.
Thank you. Thank you so much. And thanks everybody for joining. I hope I'm audible enough for everybody.
Sounds
Hello.
perfect.
Okay. Thank you. Good to be here, and I think I'll just give a little background about my presentation. First, when I joined IIDC, which is Impact and Innovation Development Center, into an adaptation role. So it was, a new role for me. So I was, looking around and trying to understand, so what is this adaptation? How do I approach it? It's a new field. There's not so much literature around. So that is how, through the collaboration that we have with the Center for Gender Equity and Health at UCSD, I got in touch with Rebecca. Most of you should know her. And through our work, I landed on the working group, Adaptation, Tailoring, and working group. So I'm delighted to be sharing with you. First, to show you our work in Uganda, but also a bit of learning about how adaptation works, and adaptation not guided by say a tested framework, a known framework, AIM, frame, or MADI, but eventually, you find out that you have adapted a bit systematically, but also, of course, it comes with its own challenges. So, real fathers that I'm going to talk about is, again, a model that is not alien to UCSD, with our colleagues at the GH. I could start with talking about, just a moment. All right, talking about IIDC. So Impact and Innovation Development Center, like you've heard it in my profile, is a non-government organization. And our work is to support partners within the East African region to design and implement scalable interventions. So we provide technical assistance in the areas of adaptation, scale-up, quality improvement, monitoring, evaluation, and learning, safeguarding through implementation, also technical assistance in the area of communication and documentation. So we support partners basically, and I'll refer to this role versus the adaptation in the coming slides. So we have been implementing an intervention called Real Fathers. And Real Fathers stands for Responsible, Engaged, and Loving Fathers. It is an evidence-based intervention. It has been tested. It has evidence, high-level evidence. And among its outcomes include intimate partner violence, increasing uptake of family planning, ECD outcomes, promoting father-child engagement, but also institutionalizing interventions for government uptake. When you look at the modules, it speaks to pretty much the outcomes that I expected therefrom. So this intervention, it is within which we made the adaptations. It has these components, being that it is a community-driven intervention, it is community-led. It starts with the selection of mentors at the community level, and this is done by the young fathers themselves, who, after understanding the program and its outcomes, as I outlined earlier, they determine whether or not to join the program. So there's self-selection at the community level. Of course, home visits, where the mentor chooses somebody who's going to be visiting him. The young father chooses a mentor who will be visiting and providing all this mentorship on the topics, the 8 topics that we talked about. Of course, including family planning, family dreams, being a good father, tips and tricks of being a good father, effective communication. So that is the content of the mentorship. And the mentor has a group of about 5 young fathers in a particular village. So after one session, he meets them from the 1st and 4th session. He meets them to get collectively, to get their feedback, perceptions about progress, etc. And then at the end, there are poster series. These poster series are intended to, show how the change has affected the community, but also to put a clear, vivid picture, of change. A young father, for example, who has never held a child, who has never gone to the kitchen, has never washed plates or did any household chores. Once they change after the mentorship, it is such photos that are now placed within the community to send a message for others who may not go through the mentorship, but they get inspired that. And of course, it closes with community celebrations, where they are organized at the community level, young fathers making commitments to be better and young fathers. Now, that is a brief about the intervention with which we made adaptations. This is how it has evolved. From 2012, that is when it was planned, piloted around 2015, and evaluated rigorously. There was an expansion to test a bit of scale up in 2018 in Karamoja and northern Uganda. And 2020, now we started working with government to achieve a bit of vertical scale up, institutionalization, to ensure that government takes it over. And in 2022, we got a grant to help us build that capacity. Having achieved now the government buy-in, it was endorsed as a government-supported model based on the outcomes that were outlined. So the Ministry of Health, Education, Gender, and Local Government were on board. And now we went into building the capacity, and this is where the adaptations started, like I will talk later. So we built the capacities of the implementers to set the ground so that when the actual scale-up comes, it finds when there's capacity at the local level. In 2023, we got a bigger grant now to scale and spread real fathers. Now, from the literature, from the experience of implementation, from previous implementers, from the developers of the model, including Rebecca at UCSD, including others like Dickens, we learned that everything else on real fathers is adaptable, except these criteria: the mentor selection process, the mentoring approach, community involvement, focus on transforming harmful gender norms, but also violence as one of the key outcomes. So these are key characteristics that are core to real fathers. And of course, like I said, we learned from other countries in Uganda, in Malawi, in Sierra Leone, Senegal, in Rwanda. They adapted real fathers and implemented it in their different contexts. Of course, noting that even when you look at it as it is here, we can see that some of the fathers were not really young fathers. They were older fathers. They were not between 15 to 25, like we had planned to do in Uganda. Some of the children were not under 3 as designed. Some of the children in other countries were actually teenagers. So it was very clear now that real fathers is adaptable, yeah, and implementable in our different contexts. So in adapting real fathers, there are a few aspects that I want to highlight. Now, we wanted definitely now to scale it up in Uganda in different regions. And of course, we looked at adaptation as the changes that are made on this evidence-based intervention, yeah, whether it's an addition, subtraction, modification, on any aspect of real fathers that doesn't compromise the quality, the fidelity of the intervention. So in all we did, we ensured that the core components of real fathers, the core characteristics and how it is implemented are not affected. So for the cultural institutions, this was now something new, because initially it was implemented at the community level. Introduce it at the community level, call the young fathers, randomly select the young fathers who are interested, yeah, because you can't take the whole community. So you have to select those who come first and take them through the training. So there was no connection to culture or religion. But in this case now, we wanted, because we were dealing with norms, we realized that the intervention is a norms change intervention, but at the same time we hadn't intentionally targeted the cultural institutions. We hadn't intentionally targeted the religious institutions. And these are the ones that deal with the mental models that influence how people behave. So what we did was to plan all these adaptations, changes that we thought were necessary, yeah? This slide helps to explain our vision for scale. So when Real Fathers was adapted, And when we got the funding to build the capacity and plan for scaling, we knew that first we had achieved a bit of vertical scale, working with the government to support real fathers, to endorse it as the government model of priority. We knew that the scaling wide in terms of spreading was also tested from Atiak in northern Uganda, which was one of the sub-counties, now to other sub-counties in northern Uganda, but also in Karamoja region. So there was a bit of scaling wide or spreading that was tested. Now, what was never tested and what was not done was how to scale deep, to really focus on the norms, the values, the beliefs, because violence against children was still continuing and still persists. So this vision of scaling deep informed our approach to engage with the cultural institutions. Now, Uganda is a cultural country, multicultural country, many cultures, many tribes. And this is just a map of how Uganda looks like. Each of the sub-regions has its own language, norms, beliefs, childcare practices. It is organized very differently from the other. And the cultural leaders have power over their communities, power and influence over their communities. And this of course, power and influence also relates to how they deal with childcare, how they deal with marriage, and how they deal with family and relationships. So to achieve the change that we wanted, we framed the scale-up intervention as scale-up through cultural regions. So from the word go, we were targeting cultural regions, which was not, of course, the initial idea of introducing real fathers. But because of the norms, values, and the idea of scaling deep to address the norms and values, we chose to take that direction. We chose 6 cultural regions, Buganda, which is the biggest, and we selected 4 districts that we are currently implementing in. Ankole, Bunyoro, Lango in the northern region, also Teso in the northeastern region, and as well as Busoga, which is the eastern region. Now, of course, to achieve this scale of a model that had been tested only in Karamoja and parts of Acholi, adaptation was never a debate because of the factors that I've highlighted here: different language, different culture beliefs, different norms, etc. Now, we realized that some of the culture regions are actually organized, and aligned with the government systems. For example, in Buganda, one constituency, has a constituency cluster of many constituencies, but at the county level, the county is bigger. It has a bit of many constituencies, So a cluster of constituencies make up a county, which is the equivalent in the Buganda kingdom structure. And they have an officer there. They come to sub-county, they have sub-county chiefs. At the parish, they have parish chiefs. Village, they have village chiefs. So in engaging Buganda kingdom, and this is just an example of how we approached this adaptation of real fathers to the cultural institutions. In approaching Buganda, they said, they would work through the system, meaning that we would have more hands in the sub-county. So as we build the capacity of this sub-county community development officer, there's also a kingdom official. As we build the capacity of the parish chiefs, there's also a parish development official. Village chief, there's also a village culture official called Omtongole. Now, this informed our, first of all, targeting and capacity building plans. As you will realize, during the training now of the TOTs in the districts, we decided intentionally to include religious and cultural leaders to be trained as TOTs so that they're able to take the intervention on the ground. How did we visualize the adaptation? So we look at adaptation in these dimensions. One, cultural adaptation, of course, which is to do with fitting culture and cultural preferences, norms, etc. Cognitive adaptations, which is more mental, aimed at simplifying content, etc. Affective emotional adaptation, which is linked to really touching people's emotion and interest. Deliver adaptation, how Real Fathers is delivered. Subject matter adaptation, environmental, operational environment, adaptations that were done, and then adaptations to the audience and participants. The core components of Real Fathers remain untouched. That is mental selection, their mentoring approach, community involvement, gender norms, change, transformation, but also the focus on violence. Those remained untouched. So the approach that we did was first on culture adaptation. We did norms diagnosis and exploration to identify culturally relevant norms around child caregiving, around violence against women, around partner relations. And this now was the first adaptations, and the aim was that we are able to address specific norms for that particular culture region. For example, Buganda, we address Buganda norms. Ankole, we address norms in Ankole. So we ensured that we did a diagnosis of norms to understand them and then influence how they are delivered. The examples that are given during the training of the mentors, during the training of the TOTs, the trainer of trainers, all of them are very context specific. Initially, during the training, because the original fathers had norms from the northern region, so we would be training people, for example, in Buganda, but the manual had norms of Acholi, and they were not relating. So that was the first, adaptation that we did in terms of fitting it with cultural preferences and acceptability. Then, in terms of the cognitive adaptation, simplifying language in the mentor manuals, revised all the mentor manual to ensure that the language is as simple as possible, removing all the technical jargon. It included, of course, also modifying the mentor manual. So Real Fathers has a TOT book for the trainers, but also a mentor manual. So because the mentors are less literate, we have a less literate mentor, but it was still a little bit complicated. So the review simplified it, but also we introduced a refresher training. Is limited. And now imagine you're training they definitely require more support in terms of understanding the content, but also making sure that they are confident, in terms of what their minds conceive, but also remember we added some components of ECD, which required simplification, more training, local examples, etc. And then affective emotional adaptation. This was more of getting to understand where people's emotions were, because when you lose the aspect of emotions, and especially in social norms change, then you may lose it. So emotions are very central in terms of changing behavior. So you look for emotional touch points for the young fathers. And we realized that religious leaders and institutions were key for behavior change. They were respected, and they really have a bit of power, yeah, over communities. So we made changes, for example, introducing TOTs, okay, engaging those cultural institutions and having TOTs who are from religious institutions like catechists, imams from the Muslim fraternity, and some pastors from the Pentecostal assemblies. In terms of delivery, the training initially was 6. It was reduced to 5 days to fit in the week. Then the use of technology and reporting. The initial Real Fathers was completely fully paper-based, but now we've introduced an aspect where we would require some mentorship sessions to be delivered online. Mentor capacity has been built and will continue to be built even through implementation. The capacity now is with the partners who will support the actual rollout, but the mentors also will be given that capacity, so that as they mentor, they are able to upload information and it comes direct. Safeguarding wasn't a key factor during the main implementation of the original Real Fathers, but now it is a core component of Real Fathers. And of course, as at IIDC, safeguarding is again another strong pillar in terms of our technical assistance. And then the number of sessions, we also added one more session because of course, the increase in content. You can't compress all that content in fewer days. So from the 3 initial days, we had put it to 6, yeah, with the revisions, but now we revised it to 5. The original pilot 2013 had 3 days training. In 2020, we changed it to 6 training days, but it was mainly because we were testing out a few things. Content was, loaded, so we wanted to be sure that the training can be conducted. But after that, we reduced it to 5. In terms of subject matter, a new ECD module was included in the content. Play spaces and materials have also been involved because of the ECD component and the value of play that has been now amplified, and there's increasing evidence that play is very, very vital. Then mentor resource sheets to guide the mentor. Yeah, the idea is that the mentor should have some information about, for example, the policy frameworks, the legal frameworks. Yeah, if it's about childcare, if it's about early marriage, so they need to know this basic information, but also ECD. Yeah, what it means. That has been added. In terms of the environmental, the broader operational environment adaptations that have been made, the original pilot did not have government leadership, yeah, but now we have the government advisory team composed of these 4 ministries: the Ministry of Health, which was never in the original pilot, Ministry of Education, Ministry of Gender, and also Ministry of Local Government. Because now government is in the driving seat, approved the model, so intentionally IIDC and the partners here, UCSD and others, determined that it is important to have an advisory committee. But also, we were never engaging culture and religious institutions, yeah? Yet the environment within which we live, there is no village that doesn't have a religious institution. And they also have power, they have governance structures, etc. So we also are intentionally targeting them and then aligning with government policy. When you read the current Real Fathers, it clearly stipulates the government policies, the NICD policy, the management strategy, including the key family care practices that it is aligned to. So with the coming in of government support, all these changes were made. And finally, in terms of the audience, initially we were targeting those young fathers who had toddlers 0 to 3, but now we are saying that even young pregnant mothers, because a pregnant mother is carrying a child who requires attention and support from the father, even when they are not yet born. So that is a new element that has also been that was made. And of course, the social norms exploration and diagnosis brought out many harmful beliefs and norms, harmful norms around male child care. When, for example, a woman is pregnant, yeah, people saying that what is our business? The child is still in the stomach, so what role do I have to play? Yeah, so that kind of lack of knowledge, lack of gap to understand that even the baby in the stomach really listens, they understand, and they play was very important. Religious leaders as TOTs, they are now a new audience, which was not there before, but also culture and clan leaders to be trained as TOTs, but also to play some other roles in terms of sharing the message. So for these culture leaders, those who are unable to really take part practically are, depending on the office they are sitting in, they are holding, they can be given other roles. Yeah, for example, in Buganda Kingdom, they said the prime minister or the minister can just give a word. Yeah, just a word. The king has said, all young fathers are expected to, for example, play with their children or take their children to playgrounds or establish play centers in their homes, and that will be, adopted quickly because of their power and influence. So that is how we visualized these adaptations. What have we learned? Now, the intensity of adaptations increases as the evidence-based intervention transitions. You will note that from the piloting phase to expansion to scaling, the adaptations and the changes kept on increasing, yeah? Because you are now targeting a wider population, a diverse population. You have to ensure that the intervention also caters for that diversity of beneficiaries. So most of the adaptations are in response to the vision of scaling, but also scaling deep. Buy-in for some adaptations may conflict with government policy. Yeah. Now, in Uganda, you cannot talk about a young father who is, for example, 15 years or 16 years. Yeah. But when it comes as a learning question that we will want to see if there are any young fathers who are below, you are, essentially saying that, yeah, we plan to include them, and therefore the intervention becomes futuristically adaptable, that it is designed to fit the government context, but also designed from a learning angle to include any young father who may be below the statutory age. So we did this, and of course, this was again to avoid any backlash with government and increase the acceptability of the intervention. At the IIDC level, we are a purely technical assistance organization, but the adaptations on real fathers have, caused also some changes within, the organization, how it is structured, how it is, operating. Again, with also, increased responsibility, increased, innovation is much more required now, as opposed to before when we were just, providing technical assistance. Yeah. So in a way, we're trying to maybe redefine what technical assistance means, that technical assistance could also include an oversight role on results, an oversight role that is linked to grants management. Yeah. So that is also one thing that we are learning, and we will see how it goes by the time we end the project. We had an opportunity that the donor was a good one. It gave us a bit of opportunity to plan. Yeah. So all the adaptations we made were planned, but one of the reasons is because we had a planning year, 1 year planning period, yeah, to plan for whatever changes, test them, dialogue, engage all stakeholders. So adaptations, especially planned adaptations, are influenced, happen more when you have time to do them. So the donor matters. Then of course adaptations, as we know, that they pave way to scaling. All right, what are we not yet sure about? The extent to which these adaptations will positively or adversely or neutrally affect real fathers' outcomes. So you realize that we did these adaptations. We did not follow any evidence-based approach. For example, like FRAME or MADI or REAIM, we did not. But moving forward, we are thinking that we definitely need to document all these adaptations and be able to measure the impact or the effect of these adaptations on the outcomes a bit more. I don't know if I can say retrospectively. Thank you very much for listening, and questions are welcome. Thank you.
Thank you so much, Mr. Kirunda. I think there are just a couple questions in the chat already, and some kudos for you. I'll start with who says question. Unless you would like to unmute yourself, feel free. But the question is, can you please share a little bit more about how you defined the key characteristics or the non-adaptable elements of the intervention? I think that would be great, Mr. Kirunda, if you could share how you clarified those that were non-adaptable, the core elements versus the adaptable elements. Just talk a little bit more about that.
Thank you. So the core characteristics, we defined them first based on learnings from the previous adaptations and interventions, like I mentioned, in Sierra Leone, in Malawi, but also in consultation with the program developers. And because Real Fathers was designed essentially to be a mentorship program, therefore, it's not like a training program, a one-off. No, it's a mentorship program. So that one doesn't change. So we adapted that based on that intrinsic factor of Real Fathers, but also community involvement. Again, looking at it, how it is, we were looking at the entire community. Yeah. First of all, how the young fathers get to know real fathers is through community mobilization. How the celebrations are done is through, community, again, sensitization, the community posters. So again, because there was a lot of community, engagement, a community responsibility, there was no way how now you would, for example, take it to maybe a facility or a school. So the community-centeredness and that awareness that it has to be community-led and community-driven and community-centered becomes core. The goal, of Real Fathers is to transform, norms, behaviors of the young fathers in terms of discipline, in terms of childcare, in terms of couple relations. And this is so much behavior. And to change, transform gender and social norms is core. Yeah. For example, if you remove the social norms component, social norms transformation, it will be difficult to ask a father to carry a child and go to town. Yeah. With the norms that we diagnosed and found out. So it means the model wouldn't be effective. It would not achieve, its aims of real fatherhood. Yeah, real father. Then the other aspect is about violence prevention. Yeah. Now this has a history. The violence prevention, Real Fathers was developed following the Konyu War in northern Uganda. Now, this war took decades in northern Uganda, and there was a lot of violence. So many people, even post-war, when they came back, there was that sense of violence, yeah? And it trickled down throughout northern Uganda, throughout Teso, and Karamoja till today, they still, violence we've had in the Western region. So that became, core, that young fathers were coming back, boys were coming back, they were used to violence in the field, used to fighting, used to beating. So that also, that historical, factor, according to, first of all, the originators, but also how we are seeing violence going on across the country, across the world, different areas, also that, made it a core component. So those are the factors that we really looked at.
Thank you so much. That's really helpful. And I almost wonder if like the functions and forms logic could be applicable to your adaptations. Functions meaning the functions of the mentorship sort of remain the same, but some of the forms, the contextual adaptations made sort of, but the actual functions or the purpose of the intervention remain the same throughout the scaling. Really, really interesting. Thank you so much. There are a couple more questions. So from Project Bob, very interesting to note that most of your adaptations were planned and in response to scaling up. Would you comment on whether these were different from when you were first implementing the program in the community? Apologies if she missed this. Was the program originally developed in Uganda?
Yes, the program was originally developed in Uganda. So, and of course, for now, because of the nature, first of all, because of the nature of the donor who gave, us 1 year to plan, to plan what we are going to do, we definitely knew that we looked at the context, looked at the contextual factors, the norms around those areas, and all these changes that were, required in the material, in the measurement system. So that gave us, a bit of time and opportunity to plan for the adaptations. But most times, for example, in the original pilot, the change in mentorship to couple the mentors and have a low literate mentorship guide, it was like an on-the-go adaptation. It was like sporadic, yeah. In the field adaptation, realizing that, oh, some of the young fathers cannot manage the content. What do we do? But you are implementing. So those were not were necessary but unplanned, and it speaks to preparation. And one of the lessons I think that we are picking from here is how maybe as we seek for grants and other development interventions, it is key, it is important to have a planning period.
Thanks so much, Bob. Claire, if I may just do a follow-up thank you to him. I think that was very interesting. It might be very, very interesting for you to show us, maybe in a forthcoming publication, how those unplanned pilot to implementation changes were different than the scaling up plan changes. I think that's just a very interesting topic. You've really hit on some interesting space over there for adaptations. Thanks so much for your presentation.
Welcome. And I see Kate is here. Kate, like I mentioned, the measurement piece is being led by UCSD. Anything you would want to add, Kate? Okay, maybe no. Yeah, but I think what we are definitely now want to do and to learn more is on how these adaptations, first of all, are different. The issue of measurement of the effect of these adaptations is quite interesting. Oh, Katie is saying sorry, she had stepped away. So there was a question on a bit of measurement on the adaptations, planned or unplanned. Of course, if there's no immediate answer, it is fine. But just if you could say something, Kate.
Sure. Thank you, Ramadhan, and sorry for having stepped away. Yeah, we are considering some of the adaptations that we're considering also will expand the age ranges potentially of the fathers and the children. This is based on community request. There are many fathers who are slightly older than 25, which is the current cutoff, and have children that are slightly older than the age of 3. Theoretically, from a theoretical perspective, there is, we've restricted to those ages currently for under the assumption that fathers will be more willing to change their behaviors if they are brand new fathers with brand new children, as compared to fathers who may be slightly older and may be a bit more set in their ways as far as parenting practices. But we are hoping in a subsequent cohort to be able to expand those age ranges and design our outcome evaluation to be able to assess those older ages to see if, from a theoretical and empirical perspective, the intervention is still appropriate.
Okay. Thank you. Over to you. Claire, yeah.
Yes. Okay. So I had a couple of my own comments and questions. I thought it was just so fascinating, especially the term scaling deep, Bob. That was the first time I've heard scaling deep, and I just was curious sort of where that emerged from, and then also in terms of scaling deep and changing, like the root of that is changing culture. I was interested in sort of measurement around that, if that's sort of like standard measures, but or if there was some sort of testing pre-post on sort of scaling deep. But just curious sort of about that term and where it was derived and maybe some measurement around that.
Okay. I think Kate may talk more about the other measurement aspects, but the scaling deep actually comes from Fraser. I think I'm going to post. It was adapted from by Riddle Moore, Scaling Deep, 2014. I'm going to put a citation and share. But the whole idea is that beyond spreading, yeah, you want to also go deep into the mindset, deep into the cultural roots to transform the mental models, the patterns, thinking patterns of the young fathers, of the cultural leaders, of the religious leaders, you know, towards the fatherhood behaviors, towards violent disciplining, and towards child care. Yeah, but I'm going to drop it in the chat.
Thank you so much. I don't know if Kate wants to add anything there, but I know we only have a couple minutes left as well.
No, nothing to add. Thanks for sharing that resource with us, Bob.
All right, thank you.
Scaling deep. Dr. Netta says scaling deep to ensure sustainability. I love that. Versus superficially scaling. There was just so many nuggets of wisdom, Bob, that you shared. Just such deep and thoughtful work. I know we'll share slides. I'll pass it over to Kara for any kind of closing remarks.
Yeah, thank you guys so much. This was such an interesting presentation. I know I've learned a lot. So I just want to say in the last minute, if you guys are interested in presenting either in October or November, please submit a nomination. I will also have our this presentation and the accompanying slides up on our website as well. And I will put the link in the chat. And it's also up on our YouTube as well. But I just want to say thank you so much for such an engaging conversation. And we will not be having our meeting in July or August, but we will reconvene in September as well. So I will also send out any emails if anything comes up, but we will be sending our newsletter around as well. So thank you, everyone. I know it's the top of the hour. I will let you go. And if you have any questions, feel free to email us and have a great rest of the week.